Hi. Do you think this health insurance reform is going to be too costly? Well, I'll tell you. Without our health insurance reform, our glorious country will not survive the future. It is not only a moral issue, it's an economic issue for us all. And I know this personally. Um, I was a single mom of 5 children years ago, and one of my sons had to go into the emergency room. I couldn't afford health insurance. We were made to wait 5 hours until he had a seizure. And because we had to wait and couldn't get the medical care that he had needed, he ended up being in intensive care for over a week on life support. Who ended up paying for that? You, the taxpayer. I didn't afford insurance, okay? Another time I had to take my mother to an urgent care center. She couldn't breathe. She was made to wait until she suffered congestive heart failure. She was taken by ambulance to the hospital where she stayed in intensive care for over a month, and then another month, and then 2 months after that in rehabilitation. Who paid for that? You did, the taxpayer. Had she had the care that she needed to have previously, it wouldn't have been nearly as expensive. My children now that can't afford health insurance, when they need to see a doctor, they go to the emergency room. How much does that cost? A lot more than going to a doctor's office if they'd had health insurance. It is not a privilege. It is a right of citizenship. I'm a breast cancer survivor. My health insurance premiums keep going up. My coverage keeps going down. Uh, it's shameful that our country, this glorious United States of America, is so far behind the rest of the modern world in health insurance and health coverage. If you have it, hey, you've got it. It's great. You know, I'm so grateful now that as I've retired, I do have Medicare, a government-run health insurance program. Without it, I'd probably be dead right now. So I'm very grateful for my coverage. Don't you want a health coverage like that? Don't you want to see your children and your grandchildren and your great-grandchildren be able to get the coverage that they need? They can still get the private coverage if that's what they want and if they can afford it. Hey, yahoo! But if they can't afford it, they have the right to receive health care. And I urge you to reconsider if you're against this reform, to really look at it, to really know that it's good to be your brother's keeper. It's good to help out others. Businesses will be helped by this. It's not just a moral issue, it's an economic issue. Please, vote for this reform. It is so needed.